that we can see your screen.
Okay, awesome. Well, thank you, Roya. Thanks everyone for being here. It's been really cool to see this conference or this event kind of progress over the years. And yeah, it's just really exciting to see everything that's happening in California. I'll give a little context on my background here in Washington, but it's definitely very cool to see like what the possibilities of MEHKOs are. So yeah, happy to be here. So as Roya mentioned, I'm a PhD candidate, which basically just means I'm working on my dissertation here at the University of Washington. I'm at the Evans School, which is the policy school here. And over the last year or so, we've been working on a qualitative study, which actually I can see some people here in the audience participated in, that sort of just tries to answer a few kind of basic questions about MEHKOs and home cooking in general, with a focus on California, but also on Washington, where it's not legal yet. In terms of background, so the way that I originally connected with Cook Alliance was when I worked at Ventures, which is a nonprofit based here in Seattle. And I worked there full time as the director of advocacy before starting my PhD here at UW. And so we kind of had a multi-year partnership where Cook Alliance was giving us a lot of advice and trying to help us pass a similar bill here in Washington. The bill still hasn't passed here, and it's been, basically a very difficult journey to try to get it passed. But I wanted to share just a little bit of history, and you can see the picture on the slide is a picture of like a little advocacy day that we did at the state capitol in Olympia here. So it was a place where we really got the movement going and had a lot of people excited about it. But for basically political reasons, weren't able to pass the bill. So, at that time, I was kind of transitioning into the PhD program and wanted to stay connected with the movement. So applied for some funding from the Population Health Initiative here, which relates to, I think, the sort of the connection between like self-employment and MEHKOs and being able to start your own business and how that relates to health, to try to answer some descriptive questions about that. And obviously, because there's not that many MEHKOs and businesses that aren't permitted are a little bit hard to track in terms of any sort of data, we decided to take a qualitative approach, and I'll talk a little bit about what that means. The purpose of the research was really to try to just basically start getting some empirical data about MEHKOs and home cooks published or out there in general, even in presentations like this where we can just talk to folks about it. Because the time when we were doing the interviews was like early 2023, so about a year ago. And it was an interesting and unique point in history where a lot of people had lost jobs or changed employment because of COVID, and we wanted to get a sense of like how that and how where people lived, what household they were in, race and gender, and the laws and policies that they were living under affected their decision to start a MEHKO, and basically like the results of how they were able to thrive or not in a home-based business. And to do that, we decided to take a focus on health. And this is both like explicitly asking people about mental health, but also asking about what we call social determinants of health. So that could be being able to afford your rent or other, financial and personal factors that ultimately relate to health, even though they're not quote unquote health outcomes. So that's kind of the frame that we're looking at through here. So what we did is we basically, as I mentioned, took a qualitative focus. And as I'm talking about the results, I just wanted to share why this is important. So when I'm talking about the results or sharing quotes here, I'm not trying to be representative of like all MEHKOs or all people who start home-based businesses. Really what we are trying to do is get at people's like experiences and perceptions of running home-based businesses and ask them to describe their experiences in depth. So this is just like exploratory, and it's not representative of the whole population of folks who are participating. And I think it's actually a really good approach here because like people who start MEHKOs are so different, and they are doing it for different reasons, have different results, even like have different goals in terms of what they're trying to accomplish with their business. So the in-depth responses I think are a lot more interesting than trying to create or identify patterns when you really have a bunch of different types of people who are doing it. what we did is we basically did, I think I did 37 interviews, and one of them ended up with someone who actually hadn't started their business. We compensated participants for their time. I think it was just like $50 to basically say thank you for taking an hour to talk to us. And then throughout the last, year or so, we've been having ongoing discussions with the Cook Alliance to try to understand our results, relate it to other like policy literature that already exists, and then also just to try to understand like what are the important research questions that that the Cook Alliance is trying to answer, and that also like could be out there in general. What this looked like was basically two things: either talking to people on the phone or over Zoom. I'm based in Seattle, so for people in California, that was many of the interviews. I also did come to San Diego for a few days and was able to do some in-person interviews, and also importantly, like visit people's businesses. That was an important part of the whole process for me to try to understand, like in person, what does this look like? And that was visiting people who are operating like formal businesses with a MEHKO permit and people who are operating informal businesses without a permit as well. And these were just some of the questions that I was asking as I was doing this. So it's like, why did you start your business? What does a typical day look like for you? So looking at working hours, and because that can have health benefits or costs as well. What are the biggest benefits or challenges of the business for you? And then we also specifically asked how the business affected mental and physical health. And what we did is, I have like 36 hour-long interviews, right? And so that's just a ton of words, a ton of data. And we do something called qualitative coding, where we basically break it up into chunks of quotes, and you'll start to see some of those come out. And that process allows us to try to be at least somewhat systematic in identifying, like, here are the trends we're seeing, here are the patterns we're seeing, and here are the connections between certain ideas that we're interested in looking at. The results I'm going to present today have kind of four main topics or four main themes. There's a lot more in the interview results, but I just wanted, I know we're limited on time, so I wanted to present something that was sort of digestible today. So I'm going to talk about like finances and financial resilience, because that's something that research on self-employment has explored already. The feelings of autonomy and control that people talked about, mental health, as I mentioned, and then also I want to address some of the topics that we've been talking about today around like what is the role of government and nonprofits like the Cook Alliance in engaging with MEHKOs and engaging with smaller businesses based out of the home. So first of all, in terms of finances, I'm just in the process of like writing up these results right now. So it's interesting how complex it is, and there's like sort of a little bit of a contradiction. So first of all, like if you look at this pie chart, you can see that about half of the people made less than $10,000. I think we were asking about in the prior 12 months. So overall, people aren't making a ton of money from the businesses that, at least the folks that we interviewed. You can see a few people were making $40,000+ where you could start to see like a full-time income. But many people were working other jobs, and these businesses were certainly, they certainly were not overall like making a lot of money and making like a main household income. But there's a couple of things that I think are a little bit contradictory about that. What I'm not saying is that you're not able to make money from these businesses. Incomes were low, but they were also capped at, I think, $54,000 during this study period. This was about a year ago. So that was when the MEHKO program actually had those limits. And that's not, a profit limit. That's a sales limit. So if you make, 10% margins on that, which I think is even quite high, then you're talking about, $5,000 of income. So that's one important aspect of it that I think we have to keep in mind. Overall, we found that like 3 of the 36 participants were making a main household income. So this is something where maybe it was the only household income, or it was, the vast majority of what was being brought in. And, honestly, like knowing small businesses and knowing MEHKOs and knowing how new the movement is and all of that, I think that's pretty impressive that of the people we interviewed, there was actually a few that were able to like start and sustain a full-time business like a year after the program was passed. So I think that speaks to like how excited customers are for this kind of thing. There was a lot of considerations around like life and household factors. So what I mean by this is like maybe somebody wasn't making a full-time income, but working at home allowed them to take care of their kids and save money on childcare, or take care of their parents and have more time to be with their aging parents. Those were both pretty common situations. Some people were full-time students and they were making sort of like a supplemental income. Of the 36 participants, 21 were doing other jobs as well. So I think that kind of speaks to the pattern. And I will say overall, like we were looking for differences in whether people were permitted, whether they were not permitted, whether they were in Washington and California, just to try to see if there were any like systematic patterns. And we didn't really see any. But the one that we did see is that nearly all male participants had another job, and only about half of women did. So I think there's some, and I think people will sort of understand this, like there's a gender dynamic that is involved in the decision to pursue self-employment. And MEHKOs, I think, are particularly well suited to women who disproportionately have like childcare responsibilities or household related responsibilities. That's not saying it's good or bad. That's just a pattern that I think we noticed as we were talking to folks. In terms of the financial benefits, the main thing that we saw was that, like, compared to other small businesses, you basically just need less capital than you would to start a MEHKO. So this is somebody who is talking about sort of like the flexibility that came along with that. They said, if something happens suddenly on a Tuesday, then we can just let the customers know, oh, we'll be closing this Tuesday. It doesn't take that much, and we are not really paying rent for that day. So you can see why that's a huge difference from some other businesses. On the flip side, self-employment as compared to other jobs does come with certain risks. So this is from someone who is a full-time student, and they were making like a small income from their it was an unpermitted business, and it was a small income, but it was their only income, and so it was very important to them. And they said, and this was in reference, I think, to like making a product for sale, and then they like mess something up. And so they said, when that happens, well, it is stressful because of the income inconsistency. It's not a fixed income. It's always estimated. Sometimes you don't even make whatever you estimated, no matter how minimum. But mentally, that is draining. That is very stressful. So you can see when you're reliant on the income, I think we definitely saw that folks were more, it was more beneficial for them when it went well, and then there was more of a cost when it didn't go well. The other thing that we looked at, as I mentioned, was this concept of autonomy and control. These responses were very common. A lot of people mentioned the flexibility, the autonomy, the self-control that they got from operating their business. And like in my mind, this is something that does relate to health and well-being, because it relates to stress, it relates to anxiety, it relates to being able to manage your personal needs. And that's something that I think is so great about MEHKOs and home-based businesses. So this person said, and this was somebody who actually, they were quite busy in their business, and they were, I think, one of the 3 people who was able to make a full-time income. So they said, in response to like, what's the biggest benefit of your business? That was the question. They said, making my own schedule. I haven't missed anybody's wedding. I haven't missed important dates. I've gotten to see my mom more. And when I was working in restaurants, I mean, even at this restaurant where you could ask for time off, but I also don't want to be like, this girl never wants to work. She's always asking for time off. So you can see how the dynamics of like having other responsibilities in their life, like family, can be a little bit better addressed, and people can take time off when they need to in these circumstances. A lot of people talked about the benefit of like feeling like they were pursuing their dream. I know a lot of people have dreams about entrepreneurship, especially in this group. And I thought this quote was really nice. This person said, because I know there's nothing like working for yourself. There's nothing like following your dream and what you want to do, as opposed to just working for somebody the rest of your life. Another person said, this allows me to do something that I love doing, that truly fills an unmet need for others and for myself, and that gives me enough of an income to where I don't feel insulted for spending all of my time doing it. So this relates to the mental health benefits that we saw as well. Again, this is perceived, so we can't necessarily say like there's a measurable mental health benefit from operating MEHKO, but we can start to see like why or how a MEHKO or a home-based business could benefit you. So this is from somebody who is doing a MEHKO as a very part-time thing. They had a full-time job that paid okay, but they were able to make a little bit of supplemental income. And they were also working in the food industry. And so I think that was part of the benefit for this person. So they said, again, it makes me happy because I get to cook. I know that one weekend a month, I'm going to get to cook what I want to cook. Something that we've created out of our brains is going to come to fruition. You don't get to do that coming out of culinary school unless you have some crazy financial backer that's going to put you in your own restaurant. We also heard a lot about like what we've been thinking about is social capital or like relationships and how those benefit from MEHKOs. This is from somebody who is a veteran and was talking about, their decision to sort of move away from the military. One of the things that I know veterans struggle with is oops, sorry, I'm blocking my screen. When we finish this, when I hang this uniform up, a lot of times we have no community or anyone to relate to outside of this. So running my business has been incredible. I know it's poured a ton of support into our family, and it's just built resiliency, not only in our family, but I like to think in our community. There were also some drawbacks in terms of mental health that we noticed. And I think, again, this is somewhat related to like our findings on income, that when people were very reliant on the business for their, material well-being, that if it didn't go well, I mean, that's really costly. So the first one, and this was again from somebody who's doing quite well in their business, said, honestly, it's hard by myself. And so sometimes it's easy because I don't have to talk to anybody about making a decision. But sometimes I wish I could just talk to somebody and be like, wait, I just want a second opinion. Another person said, and I want to talk about this because to me, this is like the real risk that came out of operating a business. It was when people had a lot of responsibility. So this was somebody who was, I think supporting a family member financially, was a full-time student, had been going through some difficult personal circumstances, had a chronic illness, and just was dealing with a lot of personal situations while they were trying to manage a business. So they said, it's even harder because I'm working on such low money that it's like I'm having to bargain. And that means I'm having to shop around and burn more gas and things like that. So just even getting in the traffic after a long day of school, getting in the traffic, and then coming back the long distance, that takes so much out of my body alone. And by then, I'm done cooking, staying up all night, not getting rest. It just hurts me. So again, this was not common, but there were a few people that displayed this pattern where they had taken on so much responsibility that managing a business by themselves on top of that was really challenging. So on the positive side of things, I think we also heard from many of our respondents that government and nonprofit was playing a really helpful role for them. In terms of the MEHKO permit, this first person said, I think this was when we were asking them if they wanted to apply for a MEHKO permit. And they said, very strongly yes, even though they were operating successfully without a permit. They said it lends a sense of legitimacy. There's someone who's kept tabs on you, and you've met a certain standard. And I know I meet that standard, and I've met that standard in the past, and I'd like to do it again because it'll make me feel more legitimate. It will. Another person was talking specifically about how I think there's a program called Access. This was in San Diego, and the program, the Get Cooking program that was offered at the local community college there. They were saying, more than anything, I'm happy because the MEHKO program and the city has supported us. And I'm happy because there are programs like Access, programs like REC. I'm grateful for the opportunities so people like myself who have dreams can grow personally and have our own businesses. And again, this was somebody who had been out of work basically, and then had started their own MEHKO and was doing quite well and sustaining a full-time income for themselves and a child as well. The last thing I wanted to note is just we did have a few responses about people who are operating either without permits or people with permits who were talking about the period before they were able to get a MEHKO permit. And this was one of those folks. They said, well, we were feeling like it would be a bummer to be shut down. It was always just like a little black cloud over our head. There's always going to be that little, what if they come knocking on the door? Are we going to be pulled out in cuffs? So it tells you that people are really feeling stressed about having to operate without a permit. And most people don't want to be. I think everybody I spoke to who's operating without a permit was pretty excited about the opportunity to get a MEHKO permit. Okay, so that's all of the results. We have a lot more data that we can share, but I just wanted to share some basic things to get started. And I see there's some Okay, there's a couple of questions in the chat, but here are a couple of like unanswered questions, I think. One thing that I think we probably wish we would have asked about but didn't was like the issue of social protection. This could be like, how does operating a business by yourself affect your health insurance or your unemployment insurance or other like protections or benefits, pay access to paid leave. And if you think about something like paid leave, it's complicated because people might be able to take more time off, but then when they take time off, they probably have to sacrifice their income, especially if they're working in an informal business. We also didn't get a chance to measure like long-term success and talk to people over the course of time. And we didn't get a chance to assess how self-employment was traded off with other employment opportunities, like why people decided to do a business instead of going back to work in whatever other industry. And I think those kind of questions are important. But I will basically wrap up there. And I don't know how much time we really have for discussion, but a couple of questions that I want to just bring to the audience are like, what else do you think I'm missing? What do you think you want us to know, or what would you like to share about your experience? And then, given what I've presented, like what other research would you like to see? Is there any other questions that you have for the world of MEHKOs or home-based businesses like this that you think could be helpful for whatever you're working on? So yeah, I'll stop there, and then I'm happy to take any other questions, and I'll read the one in the chat here too. Okay, so the question in the chat is, from the businesses you interviewed, were they collecting sales taxes? I think that there was, we didn't ask in too much detail about this, but I think most of the people who were permitted, had a MEHKO permit, were collecting sales taxes, and people without permits were probably less likely to be doing that. But most people who had been able to access permit were at the place where they had like established a business license and were able to collect sales taxes. So I think broadly, yes, but there were definitely some cases where people either didn't feel like they knew how to do it because they hadn't had a training from the Cook Alliance, for example, or they just didn't feel like they needed to because they were making a small amount of money or something like that.
And if anyone wants to, you can share your questions in the chat, or if anyone wants to unmute and ask a question. I think we have another one in the chat.
Okay, did you research home insurance costs or having a non-family employee? We didn't really ask too much about insurance, as I mentioned. I know it's an important thing, and it's something that comes up like as a need that a lot of businesses have, but we didn't really talk too much about that. And then having a non-family employee, I am not sure if there were any businesses that we talked to that had a non-family employee. Because this was in 2023, I mean, I think this was still during the basically 1 year pilot of the San Diego MEHKO program. So I think, of the businesses that were making enough income to have a non-family employee, I don't think any of them were. I think there was maybe one person who was paying a friend a little bit to help out, but pretty much we asked a little bit about that, and it didn't seem like people really had non-family employees. And then the next question is, did you meet with Spanish speakers? Are there a higher percentage of male or women operators? I'm glad you asked. So I do have some basic like statistics. So we met with, of those, of the 36 folks we met with, it was about like 2/3 were women, and we had 11 male participants. And then it was about half and half permitted and unpermitted, and that was across Washington and California. And 2 of the interviews were conducted in Spanish, actually. So we conducted the interviews in Spanish and then coded them in Spanish. And then I think one of the quotes I presented was actually relayed to me in Spanish and then translated. So, 2 of 36, I think, is not representative. But that was kind of at the end of the study when we were trying to do everything we can. I reached out a lot via various folks to Spanish speaking entrepreneurs and just didn't really hear back too much. But I think it's a really interesting opportunity for studying this, especially bringing like people into the formal economy. You know, I know there's a lot of informal work that happens in these businesses, and I think MEHKOs are just a really big opportunity to engage a Spanish speaking population. And that's true in, California, but also in places where there's lower percentages of Latinx folks. Info around diversities, discrepancies, unique concerns, and restraints important. Okay. And then Karen asks, are there any plans for follow-up research? So right now, I do not have any plans for follow-up research. I think there are a lot of interesting things that you could do, either with more interviews or probably by doing a survey, and trying to ask people and get some like quantitative data from folks. I don't really have any money or time to do that right now, but I think there's like honestly a lot of interesting questions that came up during the course of our research. So that's why I kind of wanted to ask, like, what else are people curious about, that you think would be helpful to have research on? But yeah, as of now, I don't have any plans for follow-up research, although I do have interest in doing so.
Well, thank you so much, Will. This has been really amazing to hear all of the information laid out like this. We really appreciate you taking the time and investing in doing these interviews. And actually, a lot of these findings also really helped inform the way that we structured Cook Academy and we structured Cook Community. And it's been amazing feedback to also get a snapshot of how everything is going. And so we're definitely going to be working in the future to do more studies, to do more surveys, snapshots, and hopefully look forward to continuing to work with you, Will. So thanks again. Really appreciate it.